Good morning all. I am going to talk about the minimally invasive papillary preservation techniques. So the minimally invasive surgical technique was given by the Cottinelli and Tonetti in year 2007 and the modified minimally invasive surgical therapy was produced by Cottinelli et al. At 2009. The important elements in these techniques are papillary preservation technique, modified papilla preservation technique and simplified papilla preservation technique. Let's see about what is modified papilla and simplified papilla. So the modified papilla preservation technique was given by Cottinelli in 1995. So this technique is indicated for broad interdental area and thick interdental papilla. So here the interdental space at the base of the papilla, a horizontal incision is made at buccally and it is extended towards palatal. So after placing the horizontal incision, oblique releasing incision is placed in the alveolar mucosa and it is extended to the interdental papilla in coronoapical direction. Then the palatal flap will be raised and if any bony lesions it is removed and debrided and if needed alloplastic graft materials are condensed into the defect and finally the flaps will be secured with the sutures. So moving on to simplified papilla preservation flap, it was given by Cottinelli et al. In 1999. This is indicated for narrow interdental space less than 2 mm and for any aesthetic consideration. So here an oblique incision is placed along the deformed papilla from the gingival margin at the buccal line angle of the involved tooth to the middle interproximal part of the adjacent tooth. Intracircularly, a vertical incision is placed and it is extended towards the papilla of adjacent interdental space by partially dissecting it. So then moving on to the minimally invasive surgical techniques. As I said, there are two types. One is the MIST, which is minimally invasive surgical, and there is a modified MIST, which is a modified minimally invasive surgical technique. So first in this MIST, intracircular incisions are given along the defect associated papilla with extension up to the mid-buccal or mid-lingual aspect of the associated teeth. Depending upon the width of the interdental space, the horizontal incision is either given horizontally or diagonally. This procedure mainly focuses upon the conservation of the interproximal tissues with conservative evaluation and elevation of both the buccal and the lingual flap of the defect associated papilla. So moving on to the modified minimally invasive surgical technique which is given by Cottinelli and Tonetti in 2009. This technique involves giving only the buccal intracircular incisions along the interdental papilla. A horizontal incision connects the intercircular incision. A surgical access is gained through a small buccal window. A tiny buccal triangular flap is elevated, preserving the supracrustal attachment. Then the granulation tissue in the defect area is sharply dissected and debridement is done using the mini curettes and any power driven instruments. Then primary closure is achieved by using a single internal modified mattress suture. So these are some of the important methods in papillary preservation techniques. Thank you for listening.